All right, let's talk a little bit about cardiovascular and CNS pathology, or central nervous system pathology. Only a few really apply to us in X-ray. When you get further into cardiovascular and central nervous system pathology, you'll deal a lot more with CT and MRI. But let's talk about a few anyway. So the first one is CH should be F here, or congestive heart failure. So we'll take a look at an X-ray of that, but it's the inability to propel blood at a rate and volume which is needed by body tissues to feed those body tissues. The next one are shunts, or atrial septal defects is probably a more common term, but it is a congenital lesion, meaning it's present from birth, and it is actually a hole in the wall between the heart's upper chambers. Again, it's usually present at birth, but if it's not diagnosed, it can go into adulthood and then cause a lot of problems for that person. A hematoma is a collection of extravasated blood that's usually been coagulated. If we're talking about an epidural hematoma, it's going to deal with arterial bleeding, and then a subdural hematoma deals more with venous bleeding. An aneurysm, that's going to be kind of a localized dilation of an artery, and it most commonly involves the aorta, and especially the abdominal portion of the aorta. And then finally we have sinusitis, which is an inflammation of the sinuses. Okay, so let's go ahead and take a look at our first X-ray here. Again, this is congestive heart failure, and we can see that instead of seeing the dark lung that we're used to, we see a lot of infiltrations here. It's almost a cloudy image. The next X-ray we want to take a look at is going to be our hematoma. We can see that collection of blood here. That is an area that we shouldn't be seeing. In fact, it's causing a shift of the contents of the brain. Usually we see the division of the cerebral hemispheres here. Instead, we're seeing it being being pushed over here. And again, this is a CT image, so you deal more with these things in CT and MRI. Again, here is a CT image. What we see here is where blood is actually flowing here in the abdominal aorta here. This, believe it or not, is actually a blood clot surrounding the actual blood flow here. So this is all clotted blood, and then we even see calcifications here that these arrows are pointing out here at the very outside. And then the final image that we want to take a look at, we're back to X-ray here, and we've definitely seen these before, but this is a sinus X-ray, and we can see the inflammation and starting to get kind of fluid collection here in the maxillary sinuses.